Hi everyone, my name is Cindy and I'm a fifth year MD PhD student. If you're anything like me when I was a pre-med, I was definitely a stressor and overthinker. And right before I went to my first shadowing experience, I had so many questions. What to wear, how to act, and if you're gonna be in the operating room, what to even expect. We're gonna be breaking down all of that and more in this video so I can help you guys demystify a little bit about what's gonna happen the first time you go into the clinic or the first time you go into the OR. Also, if you don't have a shadowing opportunity set up yet, but are interested in finding one but don't know where to begin, I've made a whole separate video about that, which I'll link down below. Let's now start off with what to wear to your first shadowing experience. So when it comes to dress code, if you hear nothing else in this video, just know that business casual will pretty much always work. That means if you're a guy, just a button-down shirt, trousers, nice shoes, no tie needed, no need for a suit jacket. If you're a girl, button-down, nice pants, flats will almost always work as well. I personally prefer just a button-down and some nicer pants, and nowadays I wear sneakers, but when I was a pre-med and shadowing, I wore flats. If you do want to get into the nitty-gritty of it, the dress code does depend a little bit on the clinical setting. So for example, if your shadowing experience is going to be in the operating room, you will probably end up getting hospital-issued scrubs in order to go into the operating room. And in that case, you can probably just show up in a hoodie and jeans because you're going to be changing out of them anyway. And so it doesn't really matter what you wear on your way to the hospital because you're going to be changing out of it. Some of you might also own a personal set of scrubs and are wondering if you can wear that to your shadowing experience. But again, it just kind of depends on the setting and also depends on the person you're shadowing. As a medical student, I've definitely worn scrubs to clinic and I've definitely worn scrubs to inpatient rounds, but it's really specialty specific and attending specific. Some attendings would prefer you to be in business casual no matter what, whether that's in clinic or on inpatient rounds. And in other circumstances, for example, in rounds, it is appropriate to wear scrubs. But it really just depends. I think to be safe as a shadowing student, I would just go with business casual. But if your shadowing experience is a little bit longer, like a week or a couple of weeks, then definitely try to suss out the vibe. If there are other students also wearing scrubs, then you're probably also good with wearing your scrubs. Even though there's some nuance to like what you can wear and not wear in certain clinical situations, the good news is business casual will pretty much always work. If you're in clinic, business casual works. If you're on inpatient round, business casual works. And if you're in the OR, business casual will not work in the OR, but on the way to the hospital, you can definitely wear business casual and just change out a bit. The same can't be said for hoodies and jeans, for example. Like, you can't be wearing that in clinic. You can't be wearing that on rounds, but you can technically wear hoodies and jeans on your way to the hospital to change out into OR scrubs. And so yeah. Okay, so now you know what to wear, and so now let's talk a little bit about what is expected of you when you're actually in the room. Shadowing is pretty straightforward in the sense that, as the name implies, you are shadowing the physicians. You're not really expected to do anything. You're there to observe, you're there to absorb, and you're there to learn. As far as professionalism goes, a lot of it is really just common sense. So like, be polite, be on time, be present. I know a lot of students want to take notes while they're shadowing or like jot down questions and things. And while it may be really tempting to whip out your phone and use the notes app, what I would actually recommend instead is to get a pen and paper or a little notebook. In medical school, when I was on rotations, I usually brought around a little field notes notebook. So it like fits comfortably in my pocket. It's foldable. It's like very, very lightweight, easy to bring around. And so I just like jotted all of my notes in there. And so that's what I would recommend because people don't really know what you're doing on your phone and can look like you're not being present or that you're distracted. And so I think if the purpose is to take notes, it's much better to have a pen and paper situation. Like the last thing you want to be, right, is to appear disinterested. And I feel like if you whip out your phone, even if you're taking notes, it can kind of give off the vibe that maybe you're not really interested in being there, which is not what you want to give off. And if you do want to take notes, some good things to note down would be questions you have about the case, questions you have for the physician, because you would want to save the questions for after whatever encounter or patient visit that is going on at that moment. But most certainly you'll have some downtime with the attending that you're shadowing at some point during the day, and those would be good times to ask the questions that you've noted down. I remember when I was pre-med, I was pretty anxious too on whether or not the attending would ask me like really difficult questions about the case or like expect me to know medicine. I wouldn't really worry about trying to impress them or trying to answer hard questions or getting the hard questions wrong if they ask you any hard questions, because I don't really think they expect you to know the answers necessarily because you're not even in medical school yet. And so I think what's really expected of you is really just to be professional, be present, and to ask questions at appropriate times. Now, this next part is going to be for the pre-meds who have the privilege to shadow surgery or anesthesia, which means you're going to be in the operating room. The biggest rule, honestly, is to not touch anything blue when you're in the operating room, but you don't need me to tell you that because the surgeon or the anesthesiologist will be telling you that like a bajillion times when you're actually in the room. Blue things are sterile, and if you're not scrubbed in, you don't want to be touching any of that because you will break the sterile field. Shadowing surgery is a little bit of a different experience because one, you're going to be there really, really early, and two, you could possibly be standing for like a lot of it. My recommendation is to get up a little earlier and make sure you eat breakfast. Even if you're not someone who usually eats breakfast, I would still get like a banana or like a piece of fruit, a granola bar, just a little bit of something before you head into the operating room. I think having to get up that early and stand for so long can be kind of an unexpected experience. So having a little bit of food before going into that could help. And if for whatever reason you feel dizzy or faint while in the OR, just step out. Literally, nobody will judge you for it, especially if this is your first time in the OR. The way I like to think about it is that if I do faint in the OR, that actually creates more trouble for everyone else. So I think they too would prefer if I step out if I'm feeling unwell. So that's shadowing the OR. Make sure you eat, hydrate, take care of yourself, do what you gotta do. And if you can get through the experience without breaking the sterile field, I would say that's a success. And lastly, let's talk about some to-dos after your shadowing experience. Now, one thing I wish I did as a pre-med was to actually sit down and reflect on the shadowing experience as a whole. First off, it's just nice to reflect. Second off, I think it's just good to have some kind of reflection and memories of the experience after the fact, because maybe you want to reference it for, I don't know, writing purposes, or you need some motivation to continue staying on this path. I think it's just something that's good to have. So after the shadowing experience that evening or something like that, I would just take 5 or 10 minutes and note down what you liked or didn't like about the shadowing experience, whether or not it changed your desire to pursue or not pursue medicine, and finally, noting down anything that is potentially surprising or memorable to you. And if you ended up not liking the experience, that's also totally okay. The thing about medicine is that it spans so many different fields, and just because you saw one specialty and you didn't really like it doesn't mean that you will dislike all other specialties. One physician's day-to-day can look very different from another physician's day-to-day. So if you ended up not liking one particular shadowing experience, I would encourage you to try another one and see how you like that. And finally, remember to send the physician a thank you email or a little thank you note. I don't think it's like detrimental if you don't send it, but I do think a lot of physicians do appreciate that gesture. Plus, they did spend the day mentoring you, and so I think a thank you email is a pretty nice gesture. So just as a little recap, make sure you dress appropriately, and business casual will always work. Make sure you're professional and present. If you're shadowing in the OR, take care of yourself, but don't touch anything blue. And after shadowing, make sure you do a little reflection and send a thank you email. If you're nervous going into your first shadowing experience, I hope that this video demystified it a little bit and that you're able to go into your first day with confidence. And if you're still curious about how to get shadowing, or you're wondering if virtual shadowing is worth it or how many hours you need, I've made a video about that and I'll link it right here. I'll see you guys in the next one. Bye!